Do you wonder what is the best way to have a great doctor-patient relationship? I will give you the solution. Now, this video is equally important for doctors as well as patients, because as a patient, we really want a great bonding, a great connect, a great feeling to be with our doctor. We want a faith, a trust, a comfort with our doctor that, oh yeah, I trust him. I'm very comfortable with my doctor. See, if some patient can say this, yeah, I'm comfortable with my doctor, I trust him, I know he's working hard for me and he's doing his best. See, these kind of lines are healing. Yes, they are the good healers. If somebody goes, just imagine a patient who is talking to a friend saying, yeah, I went to a doctor but then I don't trust him. I feel there's something wrong. I doubt whether he has given the right medicine. I doubt whether he have understood my problem. I doubt whether he has given the right medicine. Or I doubt whether he has advised me right investigations. Or I doubt whether he has advised me right surgery. His life is going to be miserable. Not only he is troubled by disease, but he is also troubled by the thoughts regarding disease, and also by thoughts regarding his doctor, and also by thoughts regarding his future, and thoughts regarding side effects of medicine, and all the complex thoughts regarding his risky future. The future is at risk. So disease may be troubling this much, but the non-trust on doctors is troubling this much, and medicine this much, and complication and diseases. So the basic disease remains 20% of the problem, and rest of the 80% becomes the problem of a trust, a problem of a bonding. You must be seeing so many patients unsatisfied nowadays, unsatisfied to the core. They feel let out. They feel that something is missing. They feel that something more has to happen for me to get a satisfaction. So they go to Google and they search so many things which further complicate the diseases. I have seen a patient, a very simple patient of a back pain. Now he had a back pain. Now while searching for a back pain, he went into ankylosing spondylitis site. Then he matched the symptoms according to him and Google both together. The patient and the Google, the combo diagnosed that he is having ankylosing spondylitis. Now as it was diagnosed, he went to the search more and more. And then he came to know that it is incurable. And then no patient gets cured, then they get stiff and so on and so forth. So when he was in this journey of making himself more and more sicker, his mind was completely gone. He was into depression. He was a great academic student. He lost all the interest in study. He lost interest in his ambitions. He lost his dreams. He was with pain and then stiffness. But finally, he did all the investigation. All were negative. HLA-B27 was negative. I do not mean to say that HLA-B27 negative. It doesn't mean that he doesn't have ankylosing spondylitis. But then HLA-B27, every other marker was negative. Still there can be the spondyloarthritis. But as soon as we started treatment, patient responded magically, because we don't just treat the joints or the back. There can be two kinds of treatment. One is treating the symptoms. Yeah, I am having backache, so treat backache with a painkiller and anti-inflammatory. I am having blood sugar, diabetes, so control the blood sugar. Give medicine to control the blood sugar. I am having, for example, hypertension, so give medicine to control the hypertension. So whatever medicine you have, whatever problem you have, you give medicine to control this. This is one kind of treatment. What we do is a different kind of treatment. What we do, whatever complaint you have backache, okay. You have hypertension, okay. You have diabetes, perfect. You have kidney failure, okay, no problem. Whatever your problem is, this 1, 2, 3, 4, whatever more problem is, or you have migraine, this doesn't matter a lot. What matters is the cause, where it arises from. See, it is very powerful. Here we are treating the disease which the patient has. The disease which the patient has. Here we are treating the patient who have the disease. It is completely different. So the question here is that he went to so many doctors, but unfortunately he went to super busy doctors. When he went to super busy doctors, they unfortunately didn't have a time. They didn't have a time, so they couldn't explain him much, and he was carrying that burden of same psychology. Why I want to mention this? When my team saw this, even I was not having a lot of time for that patient. But we have a hierarchy. Some kind of patient my team look for, they give time. Some kind of patient my senior team looks for, they give time. Some kind of patient I personally look for. Those were super complicated and cancers, and so I interact with them. So I give time. So we have established a hierarchy so that we can give a patient listening, a caring ear to our patient. And guys, this is very, very important. That's why we have created a model of a lot of more interaction with my team and my patients, because this is very, very crucial in building a great relationship. So now, matching this example with the doctor-patient relationship, the first and foremost thing a patient and a doctor should do is have a conversation. Very important, very profound. See, I don't want to offend any doctors who are busy by saying that you must give time. No, not that. But still, if you really want to diagnose person, if you really want to do a good diagnosis, history taking is the most crucial thing. Even we see nowadays, history taking is missing. History taking is great. It gives diagnosis to doctors. Okay, no problem. But it gives satisfaction to patient. It develops trust between doctor and patient. So more the communication, more the trust. More the right communication, more the trust. Now this should not happen that patients should say, no, my doctor should talk to me 2 hours. No, my dear friends. Please understand, we are in India. In India, per capita, if you see the ratio of doctor and patients, doctors are less, patients are too many. Doctors really don't have time. So you need to cooperate. You need to cooperate by not asking irrelevant questions, not asking Google questions. Even I have seen there's something called Googleomania nowadays. So most of the patients want to go to Google, take some knowledge, and then discuss, not just discuss, argue with the doctors, confront with the doctors. Even I experienced these things. But please, if you are doing this, you are doing wrong. Doctors have started to develop aversion for this kind of patients. Why? Because doctors see it from completely different angle, and Google can never match the doctors. Never ever. I have seen nowadays the artificial intelligence coming up. Now this artificial intelligence is naturally dangerous. Yeah, this artificial intelligence is naturally dangerous. Why? Because it doesn't understand the feelings and emotions. Suppose somebody says, okay, I am having headache. What are the possibilities? Finally, if you put it on Google, finally, somehow you will go to tumors or cancers. Anything. You try it out. You put in any problem, most of the problem will take you to cancers. Now this is something, or cancer, or only major diseases. For example, if somebody is having a back pain, he will never mention or rarely mentions of fatigue as a diagnosis, which can be, or a wrong yoga practice as a diagnosis, which is a possibility, isn't it? Or a wrong posture is a possibility. Usually, patients search for diseases and they get diseases. It is true, isn't it? Whatever you search for, you get that. But a sensible doctor will see how you are sitting. Artificial intelligence cannot see and understand. A sensible doctor will see how you are keeping your hand. Maybe you are saying backache and putting on Google that I am having backache and backache. So if you see the backache and backache, you will get something diagnosis related to backache. Maybe you are just having a kidney stone which your sensible doctor could have spotted in just 1 second. Just 1 second. So guys, don't trust artificial intelligence completely. Take it with a pinch of the salt. So trust your doctors. Who's your doctor is? Send him a message today. Doctor, happy Doctor's Day. You should send him a message because he's the one who is saving you from lots and lots of problems. You don't know because he's saving you already, isn't it? If he would have failed, you would have suffered from so many problems. So send a message to your doctor about a happy Doctor's Day. Have a great relationship with your doctors. Consult with doctor. Have a conversation with your doctor. Talk to doctor. If somebody of my patient is seeing, wish my team a happy Doctor's Day. Wish me a happy Doctor's Day. I wish you a happy Doctor Day. Because you, although are not a doctor, still you can be reason for a smile of some doctors. So have a great happy Doctor's Day. May this begin a new era of a healthcare for you. Thank you, my dear friends. Once again, share this video to as many people as possible and like and subscribe my channel and Facebook page to get these updates. Thank you.